We would like to address side effects of Parkinson's medications and possible interactions with medications that you take for other diseases. Just like any medications for Parkinson's disease can cause side effects. There are many medications used for Parkinson's disease. All of them can cause side effects, and therefore there is a very long list of potential side effects. It is very important that when you are about to start a medication for Parkinson's disease, as well as when you change, increase, or otherwise adjust your regimen, that you consult your doctor about the possibility of side effects. Some of the most common side effects are mild and do not require the discontinuation of the medications. Almost all of the side effects can be reduced or their risk be diminished by very slow titration. However, some of the side effects are difficult to avoid, and then it becomes an issue whether the side effects are more disabling or the symptoms that we are using these medications to treat for. And that balance is sometimes very difficult to evaluate. You need to have a discussion with your doctor as to how you go about those side effects. Sometimes, as opposed to reducing the medications or titrating them even more slowly, it is possible to treat the side effects with yet another medication. One example is levodopa. Levodopa is notorious for causing nausea. Most of the time, nausea is transient. If the introduction of levodopa is slow and gradual, the risk for nausea is less, and over time, nausea becomes less and less noticeable, and in the end, not limiting the use of levodopa. However, in some cases, levodopa does remain emetic, which is to cause nausea, and there is a need to address it by other means. Very often, it is not possible to replace levodopa because that is the most potent medication for Parkinson's disease, and when you do need levodopa, it is likely that it cannot be easily replaced by other medications. Therefore, the use of medications to suppress nausea is often recommended, including extra-carbidopa or even domperidone. Another example is hallucinations caused by levodopa in later stages of disease. Because the patient depends on levodopa so much from the motor standpoint, it is often not possible to reduce levodopa and try to make the side effects go away that way. The use of neuroleptics such as Seroquel or Clozaril is often very useful in that circumstance because it can easily treat hallucinations while the patient can maintain the same amount of levodopa and enjoy all the motor benefits that they actually need at that stage of disease. When side effects occur, you need to tell your doctor. If you start a new medication or if the dose is increased, it is the time when side effects are very likely to develop. If you have been on a medication for a prolonged period of time, it is unlikely that you would develop side effects from that medication at that later stage, although it is not completely impossible. The best way to know if a particular symptom you are experiencing is attributable to one of the Parkinson's medications is to temporarily discontinue the medication, which sometimes can cause worsening of your motor symptoms, but in the same time, it will help generate a very useful piece of information regarding effect and cause of that side effect.